name is Lainey Mosley, and I am the founder of CHOPS Syndrome Global, the United States organization that was founded, in about 2016 or 2017, after my daughter Leta and two other kids were identified with a very rare, ultra-rare mutation on the AFF4 gene. My daughter was the very first identified in the world, and her name is Leta, and so Leta's my daughter, and she's 26 years old, almost 27, and she was born in the dark ages. She was born when we weren't even told what her diagnosis was. They just sort of said, good luck, and we went home.
I remember where I was in the room. I was on the phone. My husband was by my side, and the doctor told me, unfortunately, Mario, as we suspected, is affected by CHOPS syndrome. There are 13 cases in medical literature. These are the symptoms. You are doing what you are supposed to do. So at the end of that phone call, my husband and I, we looked at each other. We cried, not for too long, because Mario was already asking for our attention. We were at a crossroad. Keep on crying in that room, or trying to be open to the world and tell everyone what we were experiencing. And we opted for this second option. CHOPS syndrome is an ultra-rare, multi-organ genetic disease. CHOPS is an acronym. Every letter is associated to a symptom. C, cause facial features, cognitive impairment. H, heart defects. O, obesity. P, pulmonary problem. S, shows status and skeletal abnormality.
She was like every newborn baby. She was perfect in my eyes. And she had beautiful long eyelashes, and she developed curly hair, and she looked like an angel. People told me she looked like an angel. And, then she just didn't hit any of her developmental milestones. She had failure to thrive, got pneumonia a lot, didn't walk until she was 2.5, didn't say any words.
Among the first alarm bells, when Mario was 5 months, he had bronchitis. We had some cardiological tests and discovered that he had multiple interventricular defects and needed 2 cardiac surgery. We were on holiday. He was immediately hospitalized. We hadn't the time to go back home to take clothes. And we remained for 2 months at the hospital. When Mario was 1.5 years, he underwent the second operation, a new lung hospitalization. But thanks to the expertise of doctors, he fully recovered his cardiac activity that now should be normal.
Mario.
He has a hearing loss. He has a moderate bilateral hearing loss. But of course, he cannot tell you, Mom, I can't hear you. You never know. We use this hearing aids, and we hope that everything is okay. In addition, Mario is affected by severe myopia. He's 10 and 11 diopters short, and he has also cataract. You are wonderful. Also when you wear glasses. You are wonderful.
What's been the hardest is to see Leta's behaviors and development kind of slowly diminish. She hasn't grown. She's still tiny. She maybe speaks 50 words, and some with sign language, but her quality of life is tough. And she's frustrated.
He demonstrates a lower age. He's 3.5 years, but he cannot speak nor walk. So it is quite complex to imagine him in a school context, we have to consider it, we have to decide which is the best option for him.
Leta wasn't diagnosed till she was 18 years old. And when she was finally diagnosed, it allowed us to finally have a community. It was up to me. I started a Facebook page, I started a blog, I started a newsletter, which was the only way that other families were able to find us and to go, oh my gosh, I think my child has CHOPS syndrome too. And now we're a small but mighty family of 40 plus families from all over the world with children who have CHOPS.
After a couple of days from the diagnosis, I was able to talk to Lainey mostly. She introduced me into this Facebook group, and that was a real starting point for the foundation, because the presence of the family is key in the same foundation because it is a rare disease.
They were the ones, whereas we started a community of families where to give us a sense of, a global sense of knowing each other. Manuela and CHOPS Fondazione gave us the platform to raise the money to accelerate therapeutic options. And so without them, we wouldn't be here.
Discovered CHOPS syndrome through working in another rare diagnosis called 𝗀𝗛𝗿𝗀 syndrome. If we find a good therapy, it might be a therapy for autism, it might be a therapy for lung disease, it might be a therapy for reflux or for growth. We don't know, but this is where we start from, and we hope that we improve the lives of kids with CHOPS, but also we hope that anything we find will improve the lives of other children with features like this.
We are funding an applied research project with 𝗀𝗏𝗿𝗀, and you can hear more about this drug screening proposal during Dr. Novak's talk. We published a request for application for the year 2024, and the proposals that we received were evaluated by our advisory board. We had 3 approved projects. One of them was awarded by our full grant of $200,000, and you will hear more during Dr. Izumi's talk. He will do research for us for 2 years.
You guys are doing a tremendous job, already starting to look at the population as a whole, not focusing only on the basic science, which is extremely important, but looking all the way into what a clinical trial and even approval looks like. I know when we were discussing the agreements, they were very forward-looking, much more so than other organizations, and I think that's the right approach. The fact that in 6 months we went from no data to multiple clinically actionable paths is huge. Most organizations don't have that in 5 years, 10 years. So you're already on the right path, right? You asked me earlier, is there hope? I see it right there already.
CHOPS syndrome is due to a single letter difference in AFF4 gene change. So we thought that we can target this single spelling differences as a way to modify the function of mutated AFF4 gene. So by collaborating with CHOPS Foundation, we are trying to investigate the effect of modifying mutated AFF4 gene using a cell line we generated and we obtained from a CHOPS syndrome patient. And then using genomic technology, we plan to investigate whether such an approach can normalize function of a cell with AFF4 gene change. We hope this approach works, and then we hope that that can be translated into clinical trial in someday in the future.
My work with Fondazione CHOPS began about a year ago. It's moved very quickly. They've started a grant program for basic research. They've sponsored a drug repurposing study, which has moved along extremely quickly. They organized getting samples from patients, which is critical to developing any kind of clinical product.
Philadelphia was a milestone. We went to the Children's Hospital, which is a significant place because in that place CHOPS was discovered in 2015, and it is a hospital where incredible advancement in medical and pediatric studies were made. It's a magic place. We spent 2 days there, and it was a great comfort for us, but also in a moment of confrontation between doctors, researchers who describe the state of the art of this ultra-rare genetic disease, but also the perspectives in terms of research, therapies, and maybe a cure, which is our biggest hope and desire.
La cosa più grande che si possa immaginare e sperare.
First of all, the children with CHOPS are charming. They're great kids, and the parents are, and the siblings especially, are fantastic at helping the CHOPS children out. For CHOPS in particular, I think the initiative that started is actually very promising. The repurposed drugs have worked very well. We're seeing more and more examples of successful application. And I think CHOPS is a very good candidate disease. And I think you can get drugs into clinical trials quickly. And I believe some of these will succeed.
Incredible emotions because we felt part of a scientific project, but also a human project. In the afternoon of the first days, blood test sample and skin sample were taken, and they will be used for future steps of research. And the doctor thanked us for this. The doctors are part of our medical commission because we gave them an authentic treasure.
I met Manuela maybe a year ago. She was, first of all, she's fantastic to deal with. She's the smartest of all of my sponsors. She's a professor in astrophysics, and she tells me what I do is hard, but what she does is hard, what I do is easy. And she's really a fantastic manager. She knows how to get a project moved along. I think her professional experience is a huge advantage, and she's done great work for the foundation. The ultimate goal, I think, is to have a therapy for CHOPS. And she's gone about it systematically. She's building a basic research program, and then that'll lead on to therapies. But she's made some clever decisions about who to collaborate with. They've got a lead drug that may be promising. And my role is to be part of her scientific advisory committee, advise her on what the best research approaches are and how to get the information she needs to get something into the clinic as quickly as possible.
And I have to say that maybe my job played an important role in this, because I am an astrophysicist, and since I am an astrophysicist, first of all, I am a dreamer. I look at the sky and I know that we have the power to answer to some incredible questions. We can answer to the unknown. And so our kids are a universe, and we should find answers for them. Mario? Mamma! Ma sei troppo bravo! Boh! Colpo di testa.